I was involved in quite a few research projects during my residency. A lot of my research focused around HoLEP, or holmium laser enucleation of the prostate, which is a procedure for BPH where you carve out the inside of the prostate with the laser, and you sort of get rid of the bulk of the majority of the tissue in the prostate. Some of my research on that focused on whether or not it's safe to get radiation for prostate cancer after you've received HoLEP. In our study, we did find that it is safe to give radiation to patients after they have had HoLEP, but you might want to choose a different dosing regimen in which you give less radiation per dose rather than more radiation per dose. Some of the other projects I worked on were in a clinical tool called Theodore, which was basically it was a recording of robotic surgery. And one of the roles I had in that project was reviewing the performance of junior level residents. And how Theodore worked is it would actually use AI to analyze the videos, and it could actually tell what parts of the procedure you were at just based on the video alone, which was very interesting. And I think that AI is a particularly exciting part of medicine moving forward. I think that AI is going to do a lot to improve surgical outcomes. I think it's going to do a lot to improve clinical decision making. I think there's a lot of fear and trepidation when it comes to AI, but I think that when it comes to these new technologies, you have to embrace them early, and you can't be afraid or put your head in the sand, because what will happen is people will just pass you by if you do that.